Let us now talk about the Ayurvedic interventions and their long-term impact on the health outcomes. The comprehensive approach of Ayurveda not only addresses the immediate component of metabolic syndrome, but also contributes to the long-term health benefits. Now, we can explore the sustained application which can improve the health and sustain the health through the Ayurvedic interventions. And in the go, I would consider the place of Ayurveda on strong emphasis for preventive aspects and preventive care, which can be achieved through the dietary and lifestyle guidelines, which are tailored to individual constitution of Prakriti. Studies have shown that regular use of Ayurvedic preventive measures reduce the incidence of metabolic derangements, contributing to sustained health outcomes. For instance, the adherence to Rasayana or rejuvenation therapies has been linked to enhanced metabolic efficiency and reduced oxidative stress. The second is improvement in the cardiovascular health. Metabolic syndrome is closely associated with cardiovascular risk factors such as hypertension and dyslipidemia. Ayurvedic interventions improve vascular health through multiple mechanisms. The first one is endothelial function. Arjuna or Terminalia arjuna has been shown to improve the endothelial function and reduce the arterial stiffness. And also, these are the key factors in the cardiovascular health and causing the problems of the heart in majority of people. The second is blood pressure regulation. Herbs like Sariva or Hemidesmus indicus and lifestyle practices like Shirodhara or Shirodhara oil therapy contribute to blood pressure normalization by reducing stress-induced vascular reactivity. The third is neuroprotective benefits. Emerging evidence links metabolic syndrome to cognitive decline and neurodegenerative disorders. And this can be due to the vascular narrowing or unknown factors. Ayurvedic adaptogens such as ashwagandha and brahmi or bacopa manori protect against the neuroinflammation and improve the cognitive functions by enhancing synaptic plasticity and reducing the amyloid plaque formation. This dual action addresses both metabolic and cognitive health. The fourth is weight management and fat redistribution itself. Sustainable weight management is cornerstone of metabolic syndrome treatment. Ayurvedic remedies like Vrikshamala or Garcinia cambogia and Trikatu, a blend of black pepper, long pepper, and ginger, promote fat metabolism and inhibit lipogenesis. Studies have demonstrated that these remedies reduce central obesity, a major risk factor for cardiovascular and metabolic disorders. We can now consider the synergistic integration of Ayurveda and modern medicine. One of the most promising aspects of Ayurvedic medicine is potential for integration with modern therapeutic strategies. A synergistic model can maximize the health outcome while minimizing the side effect. So let's talk of combination therapy, combining the Ayurvedic and allopathic medicines, which can, for example, Guglu used in alongside the statins can be shown to potentiate the lipid-lowering effects while mitigating this statin-induced muscle toxicity. Metformin, when supplemented with methi or Trigonella foinum graecicum, improves the glycemic control and reduce the gastrointestinal side effect associated with metformin. So we can say here the side effect of statin can be reduced with Gugulu, and side effects of metformin can be reduced by methi. And these combination therapy can be more effective with least side effects. Then we can talk about the personalized medicine. Modern medicine increasingly recognize the value of personalized or precision medicine. So Ayurveda's individualized approach based on Prakriti offers a complementary framework allowing treatment to be tailored to genetic, metabolic, and environmental factors. Emerging research shows that Prakriti correlates with the specific genetic markers, such as single nucleotide polymorphisms or SNP, and this offers a scientific basis for personalized Ayurvedic intervention. We can now talk about the stress management and lifestyle optimization, which is excellent in Ayurvedic method, and the role of stress in the metabolic syndrome is thus well documented. We can see that Ayurvedic practices such as meditation, pranayama, and abhyanga or therapeutic massage have shown to reduce the cortisol levels and improve the heart rate variability HRV and promote the parasympathetic dominance, fostering the resilience against the stress-induced metabolic dysfunction. Knowing that this is effective, we need to think of the global acceptance and the implementation of Ayurveda in metabolic syndrome. While Ayurveda is gaining recognition worldwide, several steps are needed to facilitate this global implementation as complementary treatment for metabolic syndrome. International guidelines and protocols with international recognition and standardization of Ayurvedic treatment in metabolic syndrome should be developed, similar to those established by organizations like World Health Organizations. And these guidelines can induce specific doses and the durations and contraindications so that it can be used effectively. Second is educating healthcare providers about Ayurveda's principles and evidence-based practices can foster collaboration between Ayurvedic and allopathic practitioners. Initiatives such as interdisciplinary training programs and integrative medicine conferences can serve this purpose quite well. The integration of Ayurvedic medicines into mainstream healthcare require clear regulatory frameworks to ensure safety, efficacy, and quality control. Therefore, collaboration between the regulatory agencies and Ayurvedic experts can streamline the approval of Ayurvedic drugs and therapies. And lastly, investment in research to explore the pharmaceutical properties of Ayurvedic formulation can strengthen their evidence base. Collaborative studies between the Ayurvedic institution and modern medicine research centers can accelerate this process. Now, we must think that the integration of Ayurvedic medicine into the treatment of metabolic syndrome must prioritize the patient safety and the informed consent. Patients should be educated about the benefits, risks, and evidence supporting Ayurvedic interventions. Ethical practices such as transparency in labeling and quality assurance are critical in managing the patient trust and achieving the optimal health outcomes. We can just say that the value of Ayurvedic medicine in management of metabolic syndrome lies in its holistic approach, targeting the underlying causes of metabolic imbalances while promoting the overall well-being. The integration of Ayurveda with modern medicine offers a synergistic approach, combining the best of both worlds for improved patient outcome. As research continues to validate the Ayurvedic interventions, their role in addressing the global burden of metabolic syndrome is likely to expand, and therefore future efforts should focus on a standardization, clinical validation, and interdisciplinary collaboration to make Ayurveda an integral part of the global healthcare systems.